We're good to go. Thanks a lot, everybody. We're going to talk about practice, AI in practice. And so what I've asked the panelists to do is to comment on their own sectors and how AI is being used. And I have some follow-up questions. We'll have a lot of time for question and answers for this panel. So I think that'll be very interesting. So I'm Chris Tucci, Professor of Digital Strategy and Innovation in the Business School. I'm also one of the co-directors of IX. I mainly focus on the education component. For example, the MSc program that we discussed earlier today. I used to work way back in the day, like we're talking the early 1980s here, in AI research, and eventually got very interested in how the company was funding and managing R&D and innovation. So that's kind of what I've been studying my whole career on information technology, digital technologies, and innovation management in that area. So what I'll do is I'll ask each panelist now maybe to introduce himself or herself, and then we'll go into a little short presentation by each panelist, and then I'll ask a few questions. We'll take questions from the audience. I think it'll be a lot of fun. So, Eiman.
Thank you. So my name is Eiman Kanjo. I'm the provost visiting professor at the computing department. I work in the area of pervasive computing, tiny ML, tiny machine learning, edge AI, so we try to fit small models on small devices such as wearables. So I'll talk about this in more details later.
So hi everybody, I'm Virginia Acha. I work for Merck Sharp and Dome, called MSD. I actually have an expanded role now. I lead the company's work in evidence and regulatory policy. I've been at the company now about 7 years, and I had about 20 years in pharma, before that in academia. But I think what's really important in this AI adventure is that I'm a good complement then to the stuff you've seen today, which has been more on devices and in practice, and I'll be talking more on drug discovery.
Next.
Hello everyone, so my name is Antoine Cully. I'm reader in the Department of Computing, and my research is at the intersection between AI, machine learning, and robotics, and mainly how we can use AI and machine learning to make more resilient robots. Literally, you have a robot that breaks a leg, or can we enable the robot to learn a new way to overcome the situation? And a part of my research is really like finding creative solutions for robotics, but that also extend to other applications like drug design, novel material synthesis, and things like this.
Hi everybody, thanks for coming. My name is Tim Carter. I work for a film technology business called Flawless. We use neural network technologies to automate various processes in Hollywood filmmaking, specifically lip syncing and dubbing. I am a recovering lawyer. I was an IP lawyer for the first 10 years of my career before the last 15 years in tech. So I come at it from an ethics and responsibility perspective. I run that side of our business.
Great, thank you very much, guys, and thanks for being disciplined. Let's kick it off with Ginny here, and I think it'll be a kind of a nice compliment also to what Daniel was discussing. Is really more in the pharma sector, AI in the pharma sector. So we're just going to start with a discussion on, how are you using AI in practice? How has that changed over the last couple years, if at all? And just tell us a little bit about your context.
Okay, and I'm the one who doesn't have any interesting slides or videos, because to be honest, I was struggling to know what would I put on a video. You would see a lot of people behind desks or machines, but I think what's important and what I wanted to get across today is this is not necessarily a departure in the way we do work. If anything, it's kind of an interesting extension. So I wanted to share with you a little bit of the history, which is why I have my notes when I get my dates wrong. So we generally use advanced data science. We have been using, a lot of people, when they think about pharma, focus on the chemistry, focus on the biology, but actually mathematics and data science has been there pretty much almost for almost 100 years now. So we were probably the first. In fact, we were the first company that hired a biostatistician. Do you want to guess what decade that was in? I won't say year, but what decade do you think we had our first biostatistician? Think last century first. That's my only hint. Okay, no. 1990s? And I heard 1920? Close, 1938. Oh, whoever said it behind you, 1938. We were the first company to have a biostatistician. It was very early in the science overall. We had our first full-time team then in place within the decade. But they were incorporated in broader clinical work. What really made the difference was in 1962, which some of us olders will understand was a pretty pivotal year. It was reflected the thalidomide problems. And at that point, you may think, well, FDA existed way before that. What were they doing? They didn't require data evidence in the same way. So they had kind of closer to the way you will see some nutritionals being evaluated. So they were being shown to not necessarily be cause damage to the user, but it didn't have that detailed statistical evidence package that you need to prove no harm or impact. So this is where statisticians really got their foot in the door very firmly in this space, and we had our first biostatistics team now as a full division by 1970. And now I am not kidding when I say our biostatistics department has about 450 people in it. So we are a very big statistics department, most PhD level and beyond. It's not just about biostatistics, though, of course, in AI, but I just wanted to explain, all of our work has always begun with data and evidence to better understand human biology and disease biology, and to understand how our therapeutics are going to make a difference or not. So AI for us is kind of a natural step forward to being able to do this more effectively. They aren't always smooth jumps, these trajectories, so AI is a distinct jump as far as I'm concerned. At least it seems to have all the hallmarks thereof. We are using it, and this is an interesting example today. So one of the typical examples you see in the use of drug discovery is in target screening. So being able to identify where we think a likely relationship is going to exist between an intervention and a receptor within a cell for a particular outcome. Some of you may be aware they used to have a very phenomenal amount of work around high throughput screening. Huge high throughput screening. If you'd seen these rooms, they were just, they were big machine monsters. Now, the way we do target selection can be literally in a test tube. So we use mRNA library screening techniques, which do require quite a lot of what I would say, what people have described this morning as narrow AI type use, to try and help us to do predicted target assessments. That also includes compound screening. But most of our work, and what you may not be aware of, is in the non-clinical space, also in animal model replacement. So again, for those of you who don't have to spend all day doing what I do, we spend a lot of our efforts trying to model disease and biology, because it does not make sense to try and do it in real people. It's not very ethically sound. Nobody would agree, for good reasons. We try and predict from animals, and they're not good models, especially for a lot of diseases which are affecting many people you may know, inflammation type diseases. They don't work very well in those models. So can we do AI modeling that's more effective? So the in silico, so moving from in vivo through in vitro, or assisting in vitro, and then eventually moving into in silico models. For all of these, I'm going to need a regulator to also agree with me that they're good predictors, because these are really important safety and toxicity studies. And then finally, and probably the most extensive uses in clinical, where we have site selection, participant selection, again, trying to avoid some of the bias structures that you've heard. Can we do a better job of diversity and inclusion? Can we use AI to support that? Absolutely at the minute. It also helps support data collection and review. It's good data monitoring techniques. You can identify early on if there's some perturbations in the data. And it can also then eventually provide a package that would then be potentially including additional insights on biomarkers. So again, one of the things that we'd love to be able to do, particularly for chronic disease, is to show that something is working instead of waiting until a long time. We end up with crazy situations where it's actually bad that nobody dies because I can't get an endpoint. That's not a useful thing as far as I'm concerned. So we need biomarkers, and that will give confidence in what we're finding. So AI is being used for that structures, and then and I'm just looking at R&D. You could look at manufacturing, you could look at all sorts of bits at the end. We are, because of the data privacy concerns, We do have a lot of controls over the data that we can use and train our models on, which is making it very typical for a company like mine, as most of the companies I know. They basically have an in-house version of a ChatGPT. They do not use ChatGPT. You have to have it within the firewalls and controlled. One thing, and maybe for the discussion later on a broader piece that hasn't come up today that I thought might, is some of the political dimensions around this. So as much as we are concerned about data privacy and extensions, there is actually now quite a lot of what keeps me up at night, and I was listening to Charles say what doesn't keep him up. What keeps me up at night is we may not be able to use data, we may not be able to sell products or file submissions with data that has been learned or taken from certain jurisdictions, which will be another whole level of crazy. So I'm going to stop there, but I hope that was a good opening to what we do.
Thank you very much for that. Thanks a lot. I'm going to turn it over now to Tim, and I think it should work. Let's see.
If I press the
Fingers
magic
crossed.
button, well, what could possibly go wrong? I have a couple of videos that I'm going to show you. I'm going to set them up. The first one is a short clip from a video called UFO Sweden, which is a film for which we purchased the distribution rights, and that's coming out to a cinema near you in October.
Wait, so my dad's car and the airplane ended up where they did because of a wormhole. And why wasn't Dad in his car?
Because he got out.
On the other side.
So, my dad's alive.
Police! Open the door!
You may wonder what that has to do with AI. Well, this is the original shot that was taken of that scene.
Vänta, så pappas bil och flygplanet hamnade alltså där de hamnade på grund av ett maskhål. Varför var ni inte i bilen då?
För att han klev av.
Hos de som skapade.
Så pappa lever.
So that was a film made in Sweden with a Swedish cast, shot in Swedish, which we have dubbed, visual dubbed into English, using our AI technologies. And because we work in cinema, we work at cinematic scale and quality. So you will have seen, I'm sure, a number of other examples of lip dubbing through AI on TikTok and social media accounts who probably take different underlying technical approaches to the problem. We have to ingest a 2 to 3 hour movie, scene by scene, frame by frame, and understand the language, rebuild the face based on the incoming language, and then composite that back into the frame at IMAX Super HD level. And so that's what we are focused on, and this is a final little segment just showing you a little bit about our tool.
Från hamnar på ungdomsanstalt, så du börjar hänga med de där dårarna igen.
Det var det som pappa har letat efter hela tiden. Det som tog honom.
You're one black mark away from youth custody, and you want to hang out with those idiots again?
Dad figured out what's out there. What if the farmer saw the same thing Dad's been searching for? What if the farmer saw the same thing Dad's been searching for that took him?
So, as you can imagine, there's absolutely no ethical or legal concerns with anything that we do, especially when you work in an industry that is built on intellectual property and is a compound of thousands of individual creators that go into making a single movie. Apologies for the sarcasm. So we are founded by filmmakers, and they turned to AI technology because it solved a problem that they face in making films. And I think that is a key dimension, as we saw in the previous keynote and throughout the day, technology is an enabler, it's just a tool. One of the things that I struggle with in my day job when I'm communicating with actors or producers and film studios is the term AI itself, because it contains this word intelligence, and it imposes an expectation that there is some intelligence in the machine that is distinct from the humans that are making the machine, or distinct from the humans who are responsible for using it. And that is absolutely not the case. There is no, I'm preaching to the choir, I'm sure, in here, but there is no intelligence in the machine that is distinct from the people that are making or using the machine. And we care very much about educating our industry as much as participating in it, to explain that when we can offer changes to somebody's creative vision, it's in their hands and they are responsible for how that works in favor or not for their creative project and for the people involved in it. And we have an awful lot of questions to consider, such as, should audiences be alerted to the fact that performances have been changed? Here you've seen performances move from one language to another, but you can also take a performance from one shot to another shot. You can make actors say things that they never said, and you can convey different emotions. And this sounds potentially quite problematic. There are some caveats to that. One is that everything in a film is completely fake, which sounds a bit unnecessary to say, but if you're an actor, you're already aware that you give your best performance and you don't control how that performance is put together in the edit. You don't control how you, as the actor or your character, are portrayed in the film. But the problem is there's already therefore a baseline of great human uncertainty, and we're now enabling a massive new scale of automation. So the solution here is not a technological solution, as ever, it's a human solution. The part of the business that I run is called the Artistic Rights Treasury. We are building a format for any individual or company to identify and register their rights in creative work, in personal image and performance, and having used that identity, be able to track their usage of their creative works and their legal rights in training data, in outputs, and to be able to reuse those in responsible ways. And we believe that if that system becomes endemic in the industry, then we enable all of these artistic tools without the downside that people's work is being used without credit, or people's personas in many cases are being used without their consent and involvement. And even though everything about a film is a fiction, that doesn't mean that you should lie with it. And I think there's a difference.
Great, thanks a lot. And now we'll hear from Eiman. Just go forward one, yeah. There you go.
Oh, great, okay. Just before I start, can I ask how many people have smartwatches, wearable? The ones who don't have wearable and smartwatches, can I ask why you don't have one? But I mean, are there any concerns about wearable data sharing?
I don't want my data to be hacked.
Very good. So privacy issues, costs sometimes, battery life, and so on. So we heard a lot about generative AI, large models, as if AI is all about these. But these kind of models require a lot of parameters, right? The sizes of the models are very, very big. What if we make these models smaller and make them available for everybody on small devices that are personal, that can protect privacy, and without sharing personal data? So in a way, for example, your wearable might not have even communications to communicate the data. So the data stays on the device near where it's collected. You reduce the level of missing data because you don't transmit. Actually, I have other slide. So like smaller models can eat the big models. I tried to generate this image with the DALL-E, but it didn't work very well. I spent all morning trying to stitch things together. So I still don't believe that the large language models are as good as we think, especially now ChatGPT, I think is getting less intelligent. I don't know if you noticed this. But anyway, I'm not against generative AI. I'm still okay with it. Oh, sorry. So just two, right? Just two. Okay, no worries. Okay, so so if you have these kind of small models, as I said, they will be deployed on small devices that are low cost, low energy, that can be used by people who don't have internet, for example, in rural areas, in developing countries, and they will be running all the time. That's a field that we're trying to push called TinyML, Tiny Machine Learning, the triangle of sensors, machine learning, and intelligent devices called microcontrollers, for example, that have enough power to run these kind of models. And I work with an organization called TinyML Foundation. It's based in Silicon Valley, where we try to promote this concept. In order to fit a small model on a wearable, for example, as I said, like you need the model itself to be small. So we do all sorts of techniques, for example, quantization, pruning, increase the sparsity of the model, early exit, and so on. Or even design the whole model in a way that is very, very efficient. And even look at ways where we manage data collection. Like, for example, if you have multiple sensors or like the medical kind of data that is feeding into the device, you want to make sure that these kind of data or sensors are not operating all the time. So you have to manage these kind of things in a way that the whole system works. It's not just about the optimization of the model. So in my lab, for example, we take the system approach. So we look at the data collection, the intervention in the case of the healthcare, for example, or in the case of defense and so on. So we look at the whole system. One example, we had to create some buttons and tools some fidgeting tools for mental health applications in order to label personal data on the device itself without using external tools or like post-processing, because the type of data that we're collecting. So when we start to think in terms of the system, when we take the system approach, alongside the optimization of the model, we start to find ways to solve these problems when it comes to the deployment of these models or the devices in the real world. So in my lab, we tend to deploy things in like open spaces. We have some deployments in a park north of Nottingham, for example. We have a deployment in a mental health hospital where the devices and AI is used in real world while people are walking on their devices, on their mobile phones, embedded under the tree or the bush. So the whole idea is take AI out to the wild and use it, but you can't do that with these large models that are running on very expensive computational devices. You need to find a way where we can make them smaller, and then democratize AI in general.
Great. Maybe I should actually follow up. Quick question for you, which is these edge devices. What would be some of the top? So you mentioned mental health for hospitalized patients, was it? I was just wondering if you can talk for just a couple minutes about the different applications or the top application areas for this kind of device. I
can give you a few quick examples. So healthcare in particular is very relevant to edge computing, and I'm trying to push this idea because, again, like when you ask why you don't use wearable medical devices, because people are worried about their private data. But if you have a way where you don't share the data and it's yours, and if you limit all the communications, in fact, you might not have even enough memory to store the data. So you are assured that the data is not even stored, right? Mm-hmm. So you collect an image, the images or the photo is processed straight away and it's discarded. So it's not there anymore. So that will give you some kind of peace of mind. I mean, compared to federated learning, for example, there are some concerns still about someone hacking into them. But when we talk about, a device that actually can't even share the data because the data is not there, Right? So you could even have, like, for example, we work with the Met Police on crime prevention kind of applications where we looked at detecting violence for domestic abuse kind of scenarios. So you could even listen to a conversation and say, okay, there's violence, but actually you're not recording the conversation. You're not even, the data is not there after it's processed. Right. So again, we have applications in farming at the moment. We try to deploy this in a farm in Devon, where we use collaborative learning. You have different kind of devices interacting with each other's. Defense, we have a project in that area, and healthcare in particular.
Nice. Thank you very much.
No worries.
And now let's move on to Antoine.
So yes, my research is around robotics. And the reason why I'm doing this kind of research is because I believe that robotics has a great potential for our society. Typically, what I aim to do at some point is to be able to replace humans in the most dangerous tasks they have to perform. We are still risking the life of thousands of people every day, for instance, for searching for casualties after catastrophic natural situation like an earthquake. We are still risking the life of thousands of people to collect minerals. We are still, and we had to still sacrifice a lot of retired Japanese elderly in order to shut off Fukushima. And we aim at sending even more humans on remote planets, and so for that, robotics will be a tremendous tool. Obviously, I'm not the only one on the planet to think like this. So for instance, a couple of years ago, just after Fukushima, the US government decided to bring all the greatest roboticists of the planet and create a competition, where challenging roboticists to create robots that will be able to open doors, drive cars, walk over debris, and things like this. And you can see that even if you are among the best roboticists of the planet, there are always things that will go wrong. It's, if you have played with hardware system, you know that it's just the rule, right? And I love starting all my presentation with this video because it's very funny. The issue is that it's actually a bitter truth, right? The robots on the side that you can see, they are all actual robots that were sent into actual search and rescue missions, and they had to stop their mission after a ridiculous amount of time. So for instance, the very first one is an example of a robot that was sent in La Conchita after a mudslide to try to see inside a house if some people were stuck, after the mudslide. The robot had to stop its mission after only 2 minutes of operation. And the reason is because the robot tried to do something extremely complex and challenging. The robot actually enters the living room and tried to cross the living room. Yeah, and because of that, the robot failed. The reason was simple. There was a carpet, long hairs. The hairs got stuck in the track, the robot got stuck, and eventually they had to send human to save the robot that was supposed to save the human. Well, so my goal here is, it's not a big deal if the robot falls. What we need is the robot to be able to go back on their feet and continue their mission. If they have sprained motors or sprained ankle, I don't mind. I want them to go back and limp until they find the people they are supposed to rescue. So that's the kind of research that we do. So for instance, here in the first video on the top left, you can see an example robot that I literally strip out completely one of the 6 legs of the robot. So the robot has 5 legs. It has no sensors, no capabilities to understand what is happening. There's no pain sensor, so it's not robotics.
Filming of this video.
So that's not robot abuse, right, Peter? There's no sensor. But here the robot is able to discover a new way to walk despite the damage. On the second video here, it's a quadruped robot that we train to be able to walk with only 3 legs, so keeping 1 leg away, for instance, if this leg is damaged. And you can see that even with 3 legs, the robot can maintain his robustness, his capability to walk in every different directions, to overcome pushes from operators or from the environment. And even at some point, we have students in the middle of South Kensington campus trying to destabilize a robot by pulling its back and things like this. The last video here on the bottom is a project that we are currently conducting with the US government and DARPA, where we try to use this kind of machine learning methods to prevent scenarios that happen like with the Evergreen container ship. I don't know if you remember, a couple of years ago, there was like a massive container ship that got stuck in the Suez Canal. That was just actually a control theory problem. It's because robots, so at this point, there was a big lateral wind that was pushing the robot on the side, the ship on the side. So in order to prevent and maintain controllability, the pilot or the captain just had to accelerate and to increase the speed of the ship. But by increasing the speed on a very narrow canal, that increases a Bernoulli effect that is actually attracting even more the ship to the side of the canal, creating kind of this oscillatory pattern that makes the situation very difficult to control. So here, for instance, we have simulated the same type of scenarios with a strong wind on the side, but we try to use machine learning to very quickly understand what are the forces that the system is currently experiencing, and can we very quickly, in real time, with only onboard computing, learn this and understand what is happening and offset all of this to make this transparent for the driver. So here you can see that with our system on, the driving of the robot on this narrow canal with varying wind condition is straightforward, while without the robot has to, the operator has to stop and overcome the situation. So maybe you may be wondering, oh, we are doing this. So here, what we did is that we took inspiration from natural evolution. Natural evolution is a very interesting aspect because it managed to solve a solution about a very complex problem, which is making some things that can survive in a very complex world. But what is very interesting about natural evolution is that it found actually not just one solution, but a huge diversity of solutions that are all very good in different types of situations. You have excellent fishes for undersea, you have excellent birds to fly, and so on. So that's the kind of thing we are trying to develop, and we created kind of a new field of machine learning that is called quality diversity optimization, where we try to generate thousands of different solutions that solve the same problem, but each of them solving the problem in a different way. So for instance, if you want to learn how to control a robot, you can learn how to walk, but you can also learn how to jump over obstacles. You can learn how to walk in the same direction, but by looking around or facing different directions. You can even, instead of, even if you have two legs, you can just use one foot to go very, very quickly. Here in the 3 videos on the top, we actually had one robot and we tried to discover all the behaviors that this single robot can exhibit. So we can walk on the flat terrain, like a normal robot, but we can also learn how to stand up, but we can also learn how to roll. And so this kind of creativity of different way of controlling a robot was directly and in an unsupervised way and directed way discovered by the algorithm and by its creativity. Here in this video, so it's a paper that we published. I don't know why it's stopping, but we found more than 13,000 different ways to work with the same robot, which enables a lot of resilience. If one of the legs breaks, you still have among this large collection of different ways to work, some ways that will still work. And because we were able to generate such a diversity of solutions, we thought that, actually, this can be applied to things that are beyond just the behavior of robots. Can be applied, for instance, to generate new challenging environments to train robots. So, for instance, on the top left, you can see a lot of simulated environments that are very traditional in reinforcement learning research. But here's the big difference is that all of those environments were directly generated by an AI. And when I say generated by an AI, I'm not saying generating some parameters. It's actually the Python source code of this PyBullet environment were completely designed from scratch through ChatGPT and by a nice interaction between this quality diversity, this research of creativity and diversity, in order to find this ever-expanding collection or catalog of more and more challenging and interesting environments. We also, so I don't know why the last video is not, no. So here you can see we also try to replicate natural evolution in silico. Here we try to see if we can generate a diversity or biodiversity of organisms that are interacting with a complex world and a complex environment. And so here you can see that we generated a large diversity of different shapes and colors, all behaving differently. And finally, we are leveraging now with our industrial partners this creativity in order to develop new materials and new proteins in order to generate new drugs and vaccines.
Great, and maybe I could just ask you really quickly about industrial applications. Like, what would be your top, thinking about the industrial application of some of these robots?
So we have two types of application at the moment. We have the ones that leverage resilience in terms of machines. So for this type of application, would be directly in the civilian and military or infrastructure applications. So how can you make sure that your ship or your plane is actually always behaving, and if there is an issue, how do you recover? In terms of other type of industrial application, it's everything about spatial exploration, like Mars rovers and so on. There are a lot of Mars rovers that got damaged during transport. So you don't want to send a technician to fix the robot. No, you want the robot to be able to overcome the situation. And so then the second type of industrial application that we have is everything related to optimization, and when you need a large collection of solutions that are all very diverse. That is very interesting to do this kind of interactive optimization. If you are, for instance, a game designer, you want to create a new game design. Here we can come with hundreds of different designs that are all very different, all very interesting. And then you can say, this one, and this one are very interesting. And then we can repeat and narrow the search and refine a little bit the details. So this kind of interactive optimization can be applied to a large variety of applications, from drug design to game levels to maybe interior design, if you want.
Nice. Thank you very much. I think what I'll do is I'm just going to ask maybe one more question. You can feel free to answer it, and then we'll just open up to the audience for Q&A. I'm just thinking about your sectors now. So we've identified different sectors here. And I'm trying to, I'd like to understand, speculate about the most vulnerable occupations in your sector, if any. Or it doesn't have to be job loss. It could be, people getting a different kind of job or something like that. I'm wondering if any of you would like to take a crack at this question.
I can go first, and it's something that gets discussed a lot. I think overall we're expecting AI to be replacing sort of 25% of workload in a sort of a built-up number across R&D. But a lot of that is sort of repetitive tasks or tasks that aren't really, they're not the most fun. But we have to do a lot of it. So I mentioned earlier about our evidence packages and just the amount of material and data that we put across. So we have a group on medical writing. Most companies will have a fairly extensive medical writing team. They will be doing all the written work on the protocols, the clinical study reports, any commentary back for broader use, whether that might be in scientific publication or exposure, and then finally in the dossier. And the dossiers, just to give you a sense of it, I mean, some protocols are over 300 pages. That's a clinical study protocol. That's just the protocol. The report can be thousands of pages because of all the data and annexes that you have. So it would be very nice. Right now, those are people that have to put that together. It used to be paper. Literally, there would be a truck that would go to the FDA. Now it's been more a case of uploading and that sort of thing. So the real question is AI is very good at helping with synthesis. So it can do a very nice job of, under human oversight, get to a place where you could generate a case study report fairly quickly. You could get to a place where your dossier could be more quickly pulled together. So this is where it's going to facilitate activity. So does it replace the job completely? No, probably changes the numbers of people that actually have to do that labor, but it releases them to do different things. So will we have a net loss? Not necessarily. They'll be doing hopefully higher value added work.
Great. Other thoughts? Yes. Tim?
I mean, I would say, first of all, technologists' job is to advocate for the future rather than predict it. And we are in no position to predict which particular roles are going to be improved, eliminated, or changed in substantial ways through AI technologies. I think AI automations do change the scale at which things in the film industry happen in terms of visual effects, editing. It also changes the potential of how you shoot live footage. If you know you've got a fallback or a wider array of options in the post-production side of your creative process, you might shoot differently, and that might affect the roles that are required. So the switch from film to digital, for example, eliminated a whole load of jobs relating to chemicals and film and created a whole load of jobs related to SD cards and keeping track of digital files, which turns out to be a lot harder job than keeping track of reels of film. So I would imagine new types of role being created. I would also imagine other types of role changing. How that applies is really a function of time and the industry. And the interesting thing we see is how creative people, from writers to directors and actors, are trying to pick up AI tools as initially a mirror or a reflection or a wall against which they can bounce creative ideas. And they are leading the path of application of these technologies. And so we are trying to enable them as quickly as possible to have tools that they find useful, and they will define the roles that are required to make use of those tools.
Nice, thank you. Eiman?
In my sector area of research, I think AI is empowering people It helps in terms of supporting healthy living, independence. As I mentioned before, like the crime prevention scenario, less crimes. So I would say that AI doesn't replace a human, but it empowers a human.
Nice. Great. Antoine, any final comment there?
So yeah, in my domain, I think we are more trying to enable new application and new jobs, because for instance, right now, I think the startup market for robotics is extremely complex, because you have to come up with the right electrical design or the right mechanical design and then all the control stack. And so if this requires massive upfront investment if you want to start a startup in this field. While if we can use AI to kind of streamline and simplify this setup, that will reduce the entry tickets of this market and hopefully create a way more engaging startup communities that will be creating more jobs eventually.
Nice. Okay, I think we can open up. I have some other questions, but I'm happy to open to the floor right now. If anyone has any questions, comments, or thoughts that you'd like to share with our panelists here? Yes?
Hi, directed to Tim. So Tim, the film that you showed us that you translated, you said you had to ingest 2 hours worth of film or whatever. Is it cost effective to actually do it in this manner, to translate the film? And what sort of savings are you making in that process?
So, as ever with cost, it depends on scale. So if you are at the early stage of putting this technology together, as we have been in the last 4 years, no, not cost effective. The more we do it, the better we've got at it. It is now at a point where, yes, it is cost effective in some circumstances. In this case, we still used human voices. We rehired the existing cast plus some other actors with Swedish accents who could perform in English. So you still have a bunch of cost there that is the same as you would in a traditional dub. As the people that do localization work in the film industry are adapting to our tool set, there's a learning curve. But over time, you can, as our technology improves and as people learn to use it, we can multiply the speed at which you can do localization. We can increase the creative choice that is available to filmmakers. And so cost becomes a function of those interactions between choice between speed. I just want to, quick and dirty, the whole thing dubbed in one language, or I want to pick and choose different scenes, change performances. So, yeah.
What's the time saved
Again, what's the best benchmark to give you? If you were to do a traditional dub, that is, if you include all the logistics time, etc., that's a matter of weeks. We're in that same time period at the moment.
Nice. Thank you. Other questions? I don't want to favor one side of the room versus the other. Any questions over here? Anybody? Yes.
Thank you, Chris. So I have a question to Antoine about the diversity. How do you actually quantify that? How do you measure it?
So this is a very important question. So the way we do it, usually we have kind of descriptors of diversity. So if you want to try to find different creatures of different mass, different size and height, this kind of thing. So this is when you know a priori what kind of diversity you are looking for. And so that's very good because that's kind of create a latent space or an elimination space that you can try to cover and to expand. But we have developed some method where we try to do more an unsupervised approach, where we just try to let the algorithm discover randomly what happens if you try different solutions, capture this representation of different solutions into a latent space, and try to basically maximize the entropy. So by basically trying to capture all the diversity, all the variability in the data that the algorithm can generate on its own. And it's kind of repeat or loop on itself, trying to define this space, then trying to complete and to explore this space, then reflect on all the diversity that was explored, and then expand this space over and over again. So that was, for instance, the case with the virtual creatures that you saw. This was completely self-driven by the algorithm. And finally, we have also some aspects where we can do this kind of interactive aspect where we let the algorithm figure out randomly or in an unsupervised manner what kind of diversity there is. Then we deploy this in a task and we see, okay, these kind of behaviors of these kind of traits were actually very useful to solve the downstream task. So then we can reinforce this kind of diversity traits and make sure that we explore mostly those traits and not everything. Because if you capture only the entropy, a pure white noise signal is the one that will maximize your entropy. So they're just random numbers that will not make sense. So here we are sometimes trying to find some lower representation of this kind of random signals that make sense for downstream task.
But how do you control for hallucinations? Like, how do you verify the correctness of the generated samples, especially if it was, for example, working on healthcare data or disease modeling, like all types of tumors or cancers or?
So we don't, but I think it's exactly the right thing to do. So it's actually here we have a very good tool to force the algorithm to always generate new solutions. So it's like, imagine you have one prompt for your ChatGPT, and we try to squeeze as many different and diverse answers, good answers from ChatGPT we can get. So then we can fact checks all the answer and then teach ChatGPT, okay, here you were correct, here you are wrong, try to assimilate this kind of information. So that's, for instance, what we want to do with new materials. So we use a surrogate model, so kind of a ChatGPT models in order to predict properties of new materials that we want to generate and to discover. And it happens that we discovered properties that are way better than existing materials. So it's super exciting. Maybe we found better materials that exist. Well, most likely we just found some places where this kind of ChatGPT of materials hallucinates. But that's good. That creates some sort of adversarial example that we can use to refine and improve our ChatGPT of materials. And by doing this kind of generating creative solution, challenging those solutions, and then refining models in ChatGPT, we can just make an ever-increasing and improving model that will eventually lead to some interesting discoveries.
Well, last question. Were you able to quantify the generative diversification capacity of your network in terms of the input data? So how much of what you are able to diversify is limited or controlled by the training data itself? Like if you vary the training data or you perturb it a little bit, how much diversity do you gain or do you lose?
That's an excellent question that I never thought about. And indeed, there's directly a correlation between the training data and the kind of diversity we can explore. And it would be very interesting to look into this more in detail.
Question over here.
Hi, Virginia. This question is posed to you. From a data security standpoint, what hopes do smaller businesses have who do not have the capacity to explore the options that you mentioned about managing data in-house? So what sort of hopes do they have from a data security standpoint? Because not many SMEs or businesses can actually have their own, solutions in the cloud or, I guess the opposite of having that. And the second question is, how do we then mitigate against this exploitative, I guess what's coming at us? Because it would seem as though there is a great danger of exploitation now, and that's the whole point of why some businesses are looking to keep their own data in-house, but not everyone can afford to do that. So what's really the way forward?
Yeah, I think that is for one thing, it's a great thing you're in the UK. You're probably in the best place in the world for being able to use publicly supported data sets that are valuable, and we use them too. So I wouldn't want to suggest that the data we have internally is sufficient. It's not. We have to look out to and try and seek access in various sites around the world, like Biobank or the various programs that exist in Europe. There are a number of data platforms that are very good there too. But for a small company, it's. I think part of the challenge right now is trying to get to a access terms that are calibrated well for all. So, and for the purposes. So we have been sucked into a much bigger piece. So GDPR was not designed for our sector. It was designed mostly because of concerns that were coming out of other parts of data universes. And this is, I think, everything we've seen now has been trying to course correct or sort of modify in some way, shape, or form, and I would totally agree with you. I think the worst affected are the SMEs and academic researchers through GDPR. I mean, it controls secondary use of data in a way that I don't think was ever intended, but it really does put the brakes on. So the intention, I understand, is to try and come up with workarounds, but you go member state by member state, you're going to have somebody there who is willing to lobby that situation because they approach the law totally differently. So I wish I could give you a rosier picture, but there isn't one. I think it's terrible. I think that political overlay on the data has not been helpful, and especially for health research. But for opportunities, I think there are companies out there who are seeing this as an opportunity. Complexity doesn't, have come without a silver lining. So there are companies out there that are trying to stitch together data and try and be the all singing, all dancing data service provider to companies, small companies that are trying to do work in biotech. Some of them we work with as well, so Verily or Etienne. I think the big data companies are coming from the US more than Europe, which is also interesting. But whether that's going to be true in the future, I don't think so. I mean, maybe the tiny model solution is right. Maybe there's applications there that we can use. Biobanking, particularly the UK's biobanking and our broader NHS data sets, if they're good quality, they can really make a difference. If they can be made available is the most important thing, and they don't always have that ease of use. So every time I go someplace, somebody from NHS is usually saying, we're gonna make this easier, and I don't think it happens yet. Maybe that's something after tomorrow to pick up again. I understand there's a lot more appetite in labor to do something better for the data system, but I don't have a great answer for you. I think it's a terrible setup right now.
Can I just also pick up on that? I think it makes the valuable point that the things that control the direction of technology and its application are not technical decisions. They're power dynamics, they're current, those who have capital can go and do things and then worry about the lawsuits later. Those who don't can't. And that's between large and small organizations, that's between the US and China and everywhere else. And I think the more that everybody talks about those issues in the context of technology, healthcare applications, the better, because we all have agency in what policies we think need to be in place for accessing data, and they will guide the decisions that everybody makes. We talk about this to our customers who are buying technology, and if you're a movie studio, you might feel very big compared to an actor and very small compared to the technology sector. So everybody is a fish that's being eaten by a bigger fish. And so you can find common ground on these things. And actually the truth is, the more that the understanding and the data that that understanding comes from is available commonly, not without any restriction for data or legal ownership, but is available commonly, the better. And actually academia is a fountain of all of those things. Like all of the technology that we're talking about has to some extent been invented by an academic, usually a group of academics, who have published their knowledge. That's important for academia, it's also important for capitalists like us. And so we're all part of that system. And I think raising questions like this and thinking of the power dynamics and the economics behind it is way more important than the technology.
Thanks. Yeah, my question is far more frivolous than that. But Tim, I was going to ask, so, and this is kind of relevant for everyone, but I was going to ask particularly with Flawless, do you see yourself as market makers? And if you're pitching to, let's say, a film studio, do you sort of pitch a new product? And so, for instance, I'm thinking that in the UK, we tend not to watch dubbed films that much, but we do watch subtitled films. Are you kind of pitching a new product, or are you pitching a kind of solution to a problem?
Two things. So we do pitch ourselves as solving creative problems. The more you can authentically create your vision in the final product, the better your creative experience is going to be as a creator. So we pitch that. A film is a finite set of shots that you've created, and then you stitch them together and manipulate them with VFX to try and tell your story. So we enable more choice in that So we're solving creative problems in that sense. We also solve time constraint problems and budget problems because you can do more in software than you can spend the money on in kind of physical world. But we also create new markets. So that film that you saw has had a global release in Sweden. It's a Swedish film in Swedish, and there are not many Swedish speakers. By putting it into English in a format that native English speakers are going to watch rather than watching a dub or a subtitled movie, those filmmakers, those actors, the financiers of that film get exposure to the whole English-speaking market. So that's a whole new line of business for them. And so in thinking of diversity as well, we are actively working with the Indian Bollywood movie industry, Nigerian movie industry, and others, because the translation of story between different people around the planet is a powerful thing. And we see that with the story that is playing out tomorrow in the British election, and all elections are stories. And changing people's minds or consolidating their minds through the medium of story is really important. And as someone who's joined the kind of Hollywood industry in the last year, I see the sort of things that you hear actors say at the Oscars with a bit more authenticity now, honestly, in terms of the power of story, and maybe not just contained in a film. So if we can contribute to stories that are invented and told in South Korea, reaching North America, or in Russia, reaching Brazil, that's a contribution that we feel is valuable to make. So we're selling that as well.
One last question.
Thanks. It's been a really interesting set of talks this afternoon. And I wanted to ask Virginia a little bit about the talk from Daniel earlier on. He spoke a little bit about how there's been advances with medical imaging to be able to increase privacy and, again, optimizing against model performance, as well as reducing the cost per scan. And I was interested in how that links to clinical trials from your perspective, how it might lead to increased adoption, and whether there are other barriers you think that are yet unaddressed that need to be to increase adoption for like endpoints and recruitment.
No, that's a great question, and actually, we just had ASCO a couple weeks ago, and I can honestly say most of the presentations there on novelties, they really depend on better imaging. So it's kind of, again, one of the sort of quiet moments in oncology where we focus on the therapeutic interventions, but actually the imaging around that and being able to better identify and intervene, whether it's surgically or therapeutically, is really phenomenally important. And I think we have been rate limited by the ability to do diagnosis in an effective way, particularly around the world. So one of the things that's really important for us is that if we are going to build it, let's say a biomarker that's around that has an image-related feature to it, like tau. So getting really boring here now, but dementia products, you've probably heard about the amyloid beta assessment. Well, another key metric for understanding diagnosis is tau, tau accumulation in the brain. It's really hard to do that well. And that has been increasingly challenging. And I'm doing free promotion now for my lovely friends at Lilly. They've just had their dementia product approved. And actually, in their clinical trial, they did a really nifty design, which required tau accumulation assessment as a really important precursor to being understanding whether it was relevant or not for that given patient. I think it's phenomenal research. The real challenge is, if you're a clinician in the wild, do you actually have any clue about the tau accumulation in the person sat in front of you? Probably not, at least not today. But that's the future. And if we can get better and better at combining, especially these imaging capacities to be able to do diagnoses in early, that's just phenomenal. The whole intention here is trying to get to prevent disease or to stop it in its tracks. So yeah, that for me is, and we've got pretty much our pipeline hanging on that approach. We need to be able to do a better job of diagnoses and early biomarker assessment. So no, that work and the AI, I thought that was fabulous. And the privacy features of it are critical. We de-identify data, that's a normal process using tokenization or whatever. The better we do this, the better it is for us. We do not want people to be identifiable. That's, from a commercial sense, that's useless. That kills our data stone dead. So we need these systems to work well. So I think there's a real partnership and enthusiasm about, so I was quite happily taking lots of notes during during your talk. And we have, I have colleagues that are in Munich, so I'm sure they know your work very well, but we will be very anxious to see that correlative trajectory, because it's essential. I just hope we can then convince people that we are really seriously de-identifying, because I don't think they believe it. That's the problem. So, but that's another lecture.
Great. Well, I think it's been a very interesting afternoon and a really nice panel. So let's thank our panelists. Thank you very much, guys. But that was very insightful.